Good morning. Buenos dias. Bonjour. Somebody has to teach me something Dutch, so next time I'll do that. Anyway, once again, thank you for this opportunity to share with you what God is doing through Christ Healthcare Ministry. Just to remind you, the mission of Christ Healthcare Ministry is to promote compassionate medical and spiritual services to those who need it most, with the purpose of sharing God's love. That's essentially to provide free medical care to folk who have no medical insurance. The vision of Christ Healthcare Ministry is that all individuals receive Christ's eternal healing. That, of course, is not something that we physicians could do. Christ Healthcare Ministry continues to support 2 free clinics at this time, one in Governor, St. Lawrence County, way up north, near the Canadian border, and the other one, closer to home, is in Sullivan County in Ferndale. With God's timing and His timing, we're hoping to start a new clinic in Warwick. So that's where we are. Recently, we just concluded a very successful fundraising campaign in Governor, and it was in the form of a cow plop, a very productive effort, I should tell you. But if you want to know more about it, I'll be happy to tell you later in an empty stomach, but I will tell you that if you want to. I'm thrilled to tell you what is happening at the Ferndale Clinic. We have recently incorporated the use of electronic records. Up until about a month ago, we were using paper charting, and of course people had to squint in order to read my handwriting. So now we don't have to do that. It's all legible. We use laptops that we were able to purchase, and we're able to prescribe, when necessary, prescriptions electronically. And it's basically the result of a lot of time and effort and resources, as you can imagine. Orange Regional Medical Center and their information technology department, they've devoted a lot of time and effort to bring us up to that level. They've specifically designed a template for our clinic, especially because we don't bill, and so it had to be quite unique. In regards to our own investments, our volunteers had to spend time, carve out time out of their busy schedules to learn how to use these electronic records. And that's really not an easy task. One is because we don't get to use it that often. Our clinics are open every 15 days, so by the time we learn it, within 2 weeks later, we tend to forget, so it's not an easy experience. I wish I could show you the slides, but just imagine that our volunteers, they represent the spectrum, wide spectrum of demographics. We have young, and we have a more experienced personnel. We have students, and we have people who are retirees. But they've all had to really carve out time of their busy schedules to learn how to use it. More recently, we've had the influx of first and second year medical students from the Toro School of Medicine up in Middletown. It really is difficult to get first and second year students together in the middle of the week to sit in a classroom setting. When they do that all the time and try to get them to do that, it really is impossible. In fact, it is so impossible, we weren't able to do that. We're only able to get second year students to be there in our training session. And thank God they've already been working on it. Our task ahead, our challenge is to get the first year students to learn that. Of course, we had our own volunteers, members from this congregation and others, who basically did the same and had to take time out of the schedule to learn how to use the electronic records. You should know that from this congregation, we've had members who have really devoted a lot of time. On one spectrum, let's say you had someone like Henry Vogel, who, thank God, he's been able to give us his talents, share with us his talents in terms of administrative ability and insight, analysis, and so forth. So we've had the unwavering support of Elida with her nursing expertise and her personality, and very soothing and very calming. And so at the clinic, we've enjoyed her presence. We've had Manny and his sister coming to translate. So we've had various people from this congregation help us. But I have to tell you today that attaining that goal of using electronic records could not have been done without the expert assistance and input of Dale Francis. So Dale, publicly I want to tell you that we're grateful for you being a blessing to us, for you carving out the time, but also sharing with us your expertise. I know that we couldn't do it without your help, so we're grateful to you. For all of this, we have to emphasize what says above us, to God be the glory, great things he has done. One of the other benefits, in addition to having a legible record, is that we can share that information from patients from our clinic to other providers. For instance, if one of our patients ends up in the emergency room, they're very easily, more easily able to get access to their records and find out what's been going on with them, what medications they've been getting, and how best to help them. Now, I don't know if you're aware, but another congregation in Orange County, they have been very intentional in ministering to the future leaders of our nation. They very intentionally have ministered to the cadets at West Point. And that is phenomenal, and we should be grateful for how God is using them in that ministry. I think it's very, very good. I want you to know that we should be thankful that through Christ Healthcare Ministry, this church has also been helpful, instrumental in ministering to future pillars of our society, future doctors, those medical students who right now are studying at Toro, the School of Medicine there, that as they come through our clinics, they're not only being given the opportunity to live out their faith in that setting, but they're being strengthened in their faith. One phenomena that is new for us this year is that the volunteers, the student volunteers that are coming, are not necessarily who you might consider Christians, but rather they may not even know the Lord as their Redeemer. They might be agnostics, they might be Mormons. So it's interesting that they're coming out and they're being exposed to the gospel through our clinic. And we're grateful to that. We're grateful to you for being part of that, for supporting us. Yes, we are ministering to the least among us, the poor, the marginalized, our patients. But don't forget, we're also now have this amazing opportunity to minister to those medical students. One thought occurred to me that as our level of activity increases, it's possible that we might be having the opportunity to minister to the faculty at the School of Medicine there. So for all of this, we're grateful. I thank you for this time. Thank you for your support. Thank you for your prayers. So let me remind you, Warwick is an item for prayer. There's a church, the Reformed Church there is willing to host us. We have some equipment already there. We're waiting on the Lord for a provider, to identify a provider that could take on the leadership. We'd ask you to continue to pray for our patients. We'd ask you to continue to pray for the students and others that God is reaching through this clinic. So thank you once again.